Hello, my name is Margaret Mcallister. I'm Professor of Nursing at CQ University at Noosa, and my expertise is in mental health nursing. You would know that health and medical services are strong proponents of the movement known as evidence-based practice, and with good reason. People who are ill or needing expert health care have the right to expect world's best practice. That's evidence-based practice. But evidence-based practice is not sufficient to guide practice. People also need respect, compassion, kindness, and personalised care. These kinds of qualities are less open to scientific development and instead require the cultivation of values. Learning how to use your human values as a health practitioner is, I believe, best cultivated using reasoning that is more creative. This is why in my teaching, I design learning experiences that trigger and build imagination, immersion into the lived experience of someone else. I might use trigger material from the art of Frida Kahlo to examine deep distress, or memoir excerpts to explore personal insights about topics such as eating disorder, dissociation, or schizophrenia. Or students might listen to music clips and film excerpts not because this is frivolous entertainment, but because they often contain well-considered, highly produced and succinct metaphors about the human condition and about turning points and human interactions that facilitate recovery. These kinds of trigger activities allow for the student to enter into an inquiry in a deep way. There are not clear right or wrong answers here, but rather interpretation is what matters. The experience is also giving a rest to the sometimes over-exercised muscles of technical proficiency and scientific ways of thinking that prevail in health studies. The healthcare world is in the midst of a paradigm shift. No longer is the technically competent health practitioner sufficient for a service that is increasingly consumer-driven. Quality care to consumers requires competence and humanistic capabilities. It leaves me with a question for you. Do you see ways to develop and cultivate evidence-based practice as well as a strong values-based practice?